Hello and good afternoon. Welcome to our Friday edition of Facebook Live. My name is Bud Lawrence. I am an emergency room physician here at Henry Mayo Newhall Hospital. I'm the medical director of the emergency department. And today you'll notice Larry's not here. We have a very special show for you today. We have Dr. Neela Sethi. She is a pediatrician in Valencia with Valencia Pediatrics, one of our pediatrics offices in town. And she has been so gracious and kind to come in and talk with us about what's going on here and now with COVID-19, not only in our pediatric community, but in our community in general. So, Dr. Sethi, how are you doing today?
I'm great. Thanks for having me. I appreciate it.
Well, thank you so much for gracing us with your presence. She has a very big following everywhere, Instagram in particular, at Dr. Neela, Dr. DoctorNeela, is where you can find her on Instagram. Is that correct?
That is correct.
And she always has amazing things to say, and she has great insight and explains things very well. So
thank you.
I think today, let's just kind of run through some questions.
Right.
First topic that kind of came up is, what are your thoughts on teenage anxiety in this time?
That's a big question and obviously a big topic. Teenage anxiety right now is through the roof, and as if teenagers are anxious at baseline. Let's be honest, they just are. And then add in social media pressure and the pressure of school, and that's enough to be almost too much. And then throw in a global pandemic and social isolation, and that's just a whole lot. So. I will say that I get calls every single day for parents that are worried about their teens. There's a lot that you can do. I guess the first advice that I would give to parents is acknowledge it. Instead of saying like, oh, they're fine. They're just being isolated because they're sad. Or I see a lot of parents write it off like, oh, well, I'm anxious too. And this is just a really hard thing. And that doesn't really service anyone. What we really need to do is stop, follow your gut instinct, and if your teenager is really anxious, try to help. And there are a few things that you can do. Number one is talking, which
so important.
It seems like such a simple thing to talk to your teen. But when teenagers are isolated and they are anxious and they're separating, what parents want to do is run. Because it's hard, and that's the one thing you shouldn't do. The one thing you should do is lean in. And so what we tell parents is stop in your tracks and talk to them. How are you feeling? What's going through your head right now? Talk to me about how it feels not being around your friends. And just acknowledging their feelings is huge. And so first and foremost, talking about it. Second of all, getting outside. It's another simple, really easy thing, and I know parents roll their eyes at me when I say this, like, oh, I try and he doesn't want to. Force the issue. Guess what? You're the parent.
Yeah.
Get them outside. Vitamin D. It helps. It works. Even oral vitamin D, actually. But vitamin D from the sun helps. So getting them up, getting them outside, getting them moving, having them put their phone down.
That's huge. All devices, right?
All devices.
Yeah.
But I mean, they're crazed and they're bored. And so guess what? What's the easiest thing to do is be on your phone or be on your iPad or watching TV, but just turning off the electronics and getting back to basics. Baking, hiking, journaling, moving their bodies, getting exercise. Those are such simple things, but they really, really do help. You have to think about decreasing their anxiety by increasing their endorphins, and what's the best way to do that. And then just comforting, and saying everything's going to be all right. You're the parent, and they're looking to you for encouragement. So if they're like, I'm freaking out, this is so awful, and I can't wait for this to be over, and you're saying, oh my God, this is so awful, I can't wait till this be over, it makes everybody's anxiety level higher. So what you can do is be a calming force for them and be a positive role model to say, you know what, babe, I know, and I hear you, and this is so stressful, but I'm here for you, I love you, and these are all the things that we're going to do today to try and make it better, and guess what, tomorrow's another day.
That is great. I mean, I do think our parents, many parents in the community that are watching tonight, I think you do play such an important role in how your children handle this and how your your presence guides their symptoms and their anxiety. For example, like you mentioned, if you're anxious, if the parent's anxious, the child's going to be anxious.
Yeah.
I think there's a big opportunity there. What would you say to parents who might be concerned about their kid within this coronavirus, this COVID-19 pandemic? Is there a big reason for them to worry, or are there certain things they should worry about?
I think yes. I mean, anxiety and depression can be worrisome, and we worry about increased rates of suicide. We worry about increased rates of self-harm. We worry about the long-term consequences of being isolated from their friends and family. I, especially in this amazing town of ours, have seen so many resources available online, from therapy to telemedicine. There are so many people, and let's be honest, we should be giving business to our local providers who are anxiously awaiting trying to help us. So I have seen amazing things done online with Zoom sessions with therapy, with FaceTime sessions for therapy, with telemedicine docs that are willing to help, psychiatrists that are willing to help. So I think what I tell parents is trust your gut instinct. If you feel like, gosh, this is lasting longer than it should, and this is looking like a bigger issue than what I initially had thought, reach out. Call your pediatrician. Call us. We're here to help, and that's why we're here, and we can help you triage and say, hey, you know what, this sounds okay, just a lot of TLC, and like I said, schedule, routine, getting them outside, all the things we talked about, or you know what, maybe this is a little more, let's get you into therapy and let's have you telemed with a psychiatrist and see if you meet criteria for medical therapy. Because guess what, teenage anxiety and depression doesn't just go away because there's a pandemic, and also it also just doesn't mean that it's horrible because there's a pandemic. There's got to be some middle ground.
Now, you mentioned that you're available for parents
Yes.
if there are concerns. Your office is still open, right?
We are.
Most pediatricians' offices are still open, right?
We are. We're open and we're ready and willing to see our patients. And in fact, we want to see our patients.
Right.
We want to be there for our patients. They're the light in this dark time. They're what makes us have that reason for being. And so, yes, we are available. And our office is doing telemedicine for sick patients. We're still seeing all our well care. We're still vaccinating patients. I mean, babies need vaccines. So, we're doing all of that, and we're taking our protective measures, of course, but we're still available.
And I think that's a common trend in most of the physicians in our community, that their offices are open, maybe limited hours, but they're providing these same very, very important services, as is our emergency department and our hospital. I think we've mentioned that many times before.
Yeah.
Safe places to come get the care that you need,
Right.
and to not delay when there's a need to see somebody, right?
Right.
So you had mentioned getting outside, which I think is great. I try to get out with my teenage daughters and get them some sunlight and some exercise.
Yes.
What's your thought process? Now you have a stunning scrub company, Janu Scrubs, right?
Thank you.
And they make beautiful scrubs. And her company is actually donating face masks. They've kind of pivoted and they're making face masks, and they're donating them. And we'll be donating some to the hospital as well, Henry Mayo. What's your thought about kids wearing face masks when they're outside?
Kids, I mean, listen, it's hard to get kids to wear masks. Oh, we acknowledge that, right? Like, let's start by saying our recommendations are our recommendations, and you do the best you can. We recommend our kids in our office wearing face masks, and as best you can for the lowest age group that you can, we recommend it. Now, is it hard when your kid's riding a scooter and he's outside? Of course. If you're maintaining appropriate social distance, then it's not as necessary. But for any close quarters of any age group, we do recommend a face mask. Janu, our company, is making masks, pediatric masks as well. And there are several places that you can get pediatric masks online. But yes, the best that you can do, parents, by protecting your kids. Remember, that virus is transmitted from person to person, and those masks, they function as a barrier. So the more barrier that you have, the better protected you are.
I agree. I mean, I think that at this time, clearly there's already a mandate sort of when you're out going into essential businesses and essential workers to wear masks. Yeah. Here in the hospital at Henry Mayo, we have universal mask policy. All people that are in the hospital are wearing masks. I think that's very important. Let's take a step in another direction. I think there a lot of the community has questions about how to know if you've had COVID-19, how to know if you've developed some level of immunity, the level we're not really certain about yet. But what are your thoughts on antibody testing, and where do you think that this is headed, and what do you think about it?
I mean, this is like the hot topic question,
yeah,
and like it's the number one question that we probably get in the office these days. I would love to see more widespread antibody testing available. I think the issue right now is just the accuracy of it. And so there are several companies that are offering it, but what we're finding is that the numbers are not that great. And so for the same reason that, you know, you don't hang your hat on results that you can't really have data back up. You don't want to say, hey, I'm negative, and, you know, and then be worried that you can get it when you've in fact had it. Or on the flip side, say, oh, I'm protected, wahoo, I'm going to go out in the community, and guess what? You're actually protected for a different type of coronavirus. Right. So what we're finding is that a lot of the tests that are readily available are doing what's called cross-reactivity. Now, what cross-reactivity means is that it's not just COVID-19 that it's testing for, it's pulling up other type of coronaviruses in the blood, so patients think that they're covered and protected when they're not. And there are some tests that have a false negative rate too, so it makes you think that you actually don't have the virus when you do. So what I would say is we don't have enough information. The test that we want, the number one test that everyone's talking right now about is called Celex. It's FDA approved. Well, I guess let me step that back. It's going to be FDA approved.
Almost.
It's EUA approved, which is like this sort of approval for FDA. But we can't get a hold of that test.
Right.
And so what we're telling patients right now is hold still, hold on tight. We'll do everything we can to get you that test, but when we do get the test, we have to make it a good one. And there's some question about that right now.
Agreed. I mean, I think that we've talked about this before, but the majority, you know, about 30% of the common cold is caused by coronavirus. So there are many different kinds of coronavirus,
right.
And here we have this particular coronavirus that is causing COVID-19. Very important that we find out that it's this particular virus and not some other virus.
Right.
So I think everyone kind of wants to run out and get this test. I understand why. There's a real big desire, but I think it's really important to make sure you're getting the right test, right. And at the right time too, and just you know, don't rush this. I know everyone wants to.
Right.
I've said this many times that down the road we're going to have a lot more information and a lot more data that we can drive care off of. And this is one of those pieces that I think if you give this a couple of weeks, maybe a month, or hopefully not longer, we'll have some good testing platforms that can be readily available. Maybe something that you could even offer from your office.
Yes. Yes.
And that can be something that further helps us understand where we are within this COVID-19 pandemic. So one kind of last question, because we're getting a little short on time. What's your thought about kids? We're in the middle of near the end of the school year, I would say, the school year. Right. Have you had any comments or questions or concerns from parents about things like homeschooling? Now the kids are staying home all day. Are there issues with eating healthy? These are things that I experience in my household.
Yes.
I got 2 teenage daughters. So,
right.
I've got problems.
And they're hungry.
They're hungry. They're growing. So
right.
So we got to address that.
Right.
So what are your thoughts on that?
I get that question a lot. And what I tell patients is, just as you would have sort of a schedule and routine for their life without COVID, you want to maintain some sort of schedule and routine with COVID. And so you do want to track what your kids are eating, and you do want to set some guidelines. Now, again, you don't want to be restrictive, but I think kind of planning ahead of what breakfast, lunch, and dinner looks like, and what 2 snacks, and that's really what we recommend: breakfast, lunch, and dinner, and 2 snacks. And just being mindful. And I think instead of restricting or feeling like you're harping on your kids every second, like, oh, you've already eaten, empowering them and saying, okay, are you hungry right now, or are you just bored? Or what's your carb to protein to fat ratio today? And actually teaching them about diet, nutrition, instead of restricting, because then they can say, hey, guess what? I've had a carby breakfast. I had waffles and pancakes. Maybe I should have an apple for lunch, versus, hey, I had egg whites for breakfast. And I kind of want to have this banana nut muffin that mom's baking, because everyone's baking right now. And so it's sort of unfair to say, like, oh, you should be on a diet when everybody's baking. Right. So I think it's all about knowledge. Knowledge is power with teens. Planning ahead and saying, okay, what does a week look like? This is what I'm planning for lunches. This is what I'm planning for dinners. This is what your snack's looking like. And really pushing fruits and vegetables. And then the last part is, if your kids are burning calories, you don't have to be so restrictive. So there's a really beautiful balance with burning and food. And so the more that your kids are active and the more they burn, the more they sort of allow in their caloric requirement for the day. So finding that middle ground and encouraging them to be active, but also teaching them about nutrition is just super, super helpful. And of course, you can't tell them to not eat mom's banana nut muffins. That's just not fair.
Right.
You know?
Right.
So
I'm personally still trying to find that balance.
Yeah. Aren't we all? Aren't we all?
So, Dr. Sethi, I really want to thank you so much for coming in and mostly for taking care of one of our most precious resources, our children.
Okay.
I mean, really one of the most noble jobs in medicine is pediatrics and helping grow our children, our future generations. Thank you so much. And thank you for coming in and sharing your knowledge. Obviously, she has an exceptional amount of knowledge in this area, where out in Santa Clarita we have many parents with many children.
Yeah.
I think this is something that we are very thankful for her community service to deliver this information in an digestible way to the community. Again, you can find her on Instagram at Dr. Neela, DoctorNeela, for more information similar to what you found today, potentially. Great resource. Thank you so much for all you do. And thank you for all you do staying at home and allowing us to flatten the curve. I want to let you know it is absolutely working here in Santa Clarita. I know you're making those sacrifices, both socially and financially, and we thank you so much for that. Thank you for joining us today. Have a great afternoon. Be safe and be well.
Be well.